I'm Dr. Matt Sheehan, chiropractor at Medford Family Chiropractic Center in Medford, Oregon. And I'm here today with my friend Angie Orr, who's a licensed massage therapist here in Medford, Oregon. And we're here today to demonstrate a simple stretch for the upper back in extension, which is leaning back. And the reason that I use this with some patients is when we start to get the postural problem where we're starting to slouch forward like that, right? And the shoulders roll forward. Both Angie and I and body workers all over the world end up seeing this all the time. It starts out with us just getting, as I call it, fluffy. Our muscles start to get a little weaker, and gravity starts to win, and our shoulders start to come forward like that, and the chest muscles tighten. So we want to counteract that by stretching the chest, and as that stretches out, the upper back can come backwards. So this is just one of two parts, stretching all that out over time, and then strengthening the muscles between the shoulder blades so that we go from this to this, and we can hold ourselves upright. And that alleviates a lot of neck issues as well, because as this comes forward, the head tends to jut forward, and it causes all sorts of problems with neck pain, headaches, all sorts of problems. Okay? So what we're going to do is we're going to have Angie down on the floor. So Angie has not done these before, so this will be a good way to see. Angie can ask me questions if she has any questions about what the heck I'm showing her. Similar to questions that you as patients would be asking. So, Angie, what I'm going to have you do is you're going to lie flat on your back. You're going to put this under your upper back.
In between the shoulder blades?
Yes, in between the shoulder blades, that's right. And for your head, what you're going to do is you're going to support your head on your hands, back of your head. There you go. Ooh. And what I want you to do is I want you to slowly roll forward till you're right in the middle of the shoulder blades, right about there. Good. Now, one way to not do this exactly right is to allow your head to come back into extension as your upper back comes back. You don't want to do that. You want to keep your chin tucked. So that's right. You're going to hold your head right there and scoot down just. There you go, a little more, right about there. Good. Okay. Yeah. And as you're using a foam roll, often you're going to feel some pretty sore spots. This piece of equipment is not for the faint of heart. If you have any issues in your spine where you're rolling up and down, you'll know how your muscles are. They will speak to you very quickly. Typically, with most of us, it's going to be right between the shoulder blades where we start to get that increased curve. So you're going to want to be right between the blades, and then you're just going to gradually allow your upper back to extend over it as those muscles gradually start to relax. So you're going to hold it for a minute, even a couple minutes, and as it slowly relaxes, you allow yourself to come back. And quit when you're bored. There's no set amount of time necessarily to hold this, okay? And there we go. Ange, thanks for demonstrating that one. So with this, typically you're going to do this in an ideal world every day for probably a couple weeks to a month, something like that. And over time, as the chest and the front stretches out and the muscles between the shoulder blades stretch out, you'll notice yourself being able to arch your back with less resistance. So this right here is the handout that I give most of my patients when I'm showing them this particular stretch. So this is the one that we're referring to off this sheet, just so you know.